Thank you for joining us for our webinar today, Drive More Consumer Insurance Sales. My name is Dennis Reiner. I'm with GoldenCare USA, and joining me is my good friend Nathan Quayle. Nathan's going to walk us through an exciting opportunity on how you can increase sales and actually be more efficient in your running your business. So Nathan, I can see your screen, and just a couple of quick housekeeping items as we start in. Everyone will be in listen-only mode, and if you want to type in questions, please feel free to do that. A couple of housekeeping items. As a GoldenCare agent, you may be aware that there's a lot of other value-added benefits that you get, and on the screen here is some of those that are listed. And so as we start in, Nathan, let's go to the next visual, and I'm going to turn it over to you after a couple more comments here. So today, in today's marketplace, technology can be your friend. It also can be a challenge for some of us, just like we had some challenges this morning here with the GoToMeeting site. But today, more importantly, consumers are researching not only yourself, but they're also researching products and services that they want to do business with. So I'm going to turn the time over to Nathan, who is going to walk us through the next couple of visuals and get us into a demo. And all total will probably run about 30 minutes or so, and we'll go from there. So Nathan, the time is yours.
All right. Well, thank you everybody for attending. We're just gonna go over something real quick. So normally there's people that fall in different categories, and it might be driven based off of where you've been from, where you're coming from, what your business practices were in the past. But as we all know, just like Dennis said, our customers are evolving and they're wanting more, and they're being more educated because everybody has this powerful, master computer in their hands called a cell phone these days. And so they are doing their own research, not only on products and services that they might need, but also on you as an agent. So there's a bunch of people that fall into I don't have a website, I didn't see the need. I think we just talked about what some of those needs are. B, have a website, but really only a fancy digital business card, right? It's not very flashy. It just says who you are and maybe a couple products that you might offer, nothing too special. C, have a website, but only does quote captures. So the customer can't actually really learn or do anything transactional on it. And then D, which is why we're sitting here all today on this wonderful webinar, is there's a want out there. They want, and in all caps you see here, need a website that looks good, does quote capture, allows consumers to do it yourself, DIY your own insurance. Now, for a lot of these people, the DIY is, for them to learn and then come to you as the expert, but they want to have a base understanding before they talk to you, the expert. All right, so that's the big one there. So now we're going to jump into the live demo of what the website is, of what we're looking for. All right, so EIA and GoldenCare have formed a wonderful partnership to where we wanted to offer this to all of the GoldenCare agents, where what we have is the capability. And just so I'm clear, Dennis, I got two screens up. I want to make sure that you're seeing the website right now. Is that true?
Correct.
Great. So as you can see here, what we're offering you is not just that business card, but a true transactional insurance marketplace that you can promote yourself, your products, and your customers can find a lot of value from. So let me just give you a quick high-level navigation of what we have here. And I'm going to minimize this to the corner here. All right, so what we're offering you, like I said, is a insurance marketplace. One where you can have a professional look and feel, customers can educate themselves, and also customers can do some transactional capabilities like quote and even buy insurance from your website. So on here, you can see it's got customization where every agent has the ability to put in their phone number, their email. Our websites are in both English and Spanish. They can press the Spanish flag to convert everything to Spanish. And they can go back to English. You can choose which product tiles you want to present on this website. You can do an upload of your picture and a write-up about you. So that way, when customers go to do a little research on you and they find your website, not only will you be more professional and more capable, but like I said, from a transactional perspective, they can come in here and they can either learn about you, they can learn about your insurance products, and then these insurance products are really, really great from the standpoint of you can round out your product portfolio. So even with just a life insurance license, you can offer auto, home, renters, small business, and other property casualty products through our partnerships and receive referral fees so that you can essentially be a full suite of products. And we have a lot more products. We just simplified it here so that there's only a certain handful here for you to share. So let's just dive into one of the products as an example. Your customers can come in here to auto insurance. They can learn about the different coverages, why you need it, how much you need, all that good stuff. And they can get quotes and they can do it all online. And as you're not a P&C licensed individual, of course, you can't sell this, but they can buy from your website online and we can pay you a per qualified quote fee. So this can also be a money earning potential for you in the way that this works. So you also have the ability to, we can build you your own product tiles. So if you are really big into certain, long-term care, Medicare, longevity planning, as you can see, we have these relationships with GoldenCare already, to where you can present your information and customers can come out here and learn about the products that you have to offer already, and then you can round out that product portfolio with us. Now, the way that we've set this all up is very simple. We have struck a wonderful balance between customization and flexibility. So I'm going to jump in here to the back office and show you how easy it is to set up your website. So I'm going to sign in. So we have a set up your website button, and we'll just go through it real quick. You can pick your own domain name. You can input your own contact information and about you. So just like we went through and saw on the About Us page, this is where you can put in your About Us information, your contact information, all that great stuff. We can get into your profile, your picture, where you can upload that. You can even white label our websites. So you can update your own logo so that instead of it saying EIA, it can be whatever your company's name is or what you'd like it to be. So you can replace this EIA that's on your website with your own logo. You can set up all of your social media and connect this to your Facebook, your Twitter, Instagram, LinkedIn, all that great stuff so that people can find you, along with search engine optimization. So when somebody is Googling and finds your company, what is it that Google says about you? You can control all of that very simply with your website. As we discussed, all of these product tiles, all of these insurance products that are available here, you control those in your back office. You can turn on certain products. Maybe you're running a promotion this month, all about whole life insurance, and all your marketing on, Facebook and email marketing and that type of stuff is around whole life. Well, you can focus on whole life and you can minimize your product tiles. Maybe the month after that, you're talking more about, term life insurance and you're targeting a different demographic. Great. You can turn that one on or you can keep them all on. It's up to you. And you can very easily change them. So I'm going to make a couple changes here. I'm going to uncheck some stuff. And then I'm going to save the product selection. I'm going to go back over to my website. And right now, you'll see there's certain products, virtual primary care, then auto insurance. Let's jump right in. And I'm going to go to and there it is. I've made that change. Now this True Freedom Home Care is the second product tile that I wanted in place. And it's that easy and that quick. Something else that's very unique with our websites and our capabilities is that not only can consumers come to your websites and learn about insurance, but you have the ability to control whether or not you want them to get even further in the process. So let's pick on longevity planning. So if you do not have a relationship, if you were an agent, let's say that focused on term life in the past, and you're not a longevity expert with long-term care and life insurance that has long-term care riders and things like that, if that's not your area of expertise, we have formed a relationship so that you can get access to those experts, and you could then give a lead to those people to actually help you with this more difficult product. Just as easily though, if that is your expertise, we can go into the back office, and in longevity planning, I can delete that link. Then I can go back into my website, refresh. And now if somebody got to my longevity planning page, I want them to contact me. They're going to provide their information. And the beauty of this is when you do this quote request capture form, is that they get to check what products they're interested in. And when they hit submit, that emails that request to you, the agent, so that you know that I have a customer. Here's their first name, last name, phone number, email, address, all that good stuff. And they're interested in these products. And so now you have time to do a little bit of research, a little bit of extra work before you give them a call to make sure you have all the stuff proper and ready for them so that the sales process can be extremely smooth and beneficial for all parties. Now, we also offer a bunch of other really great products and services that you can see in the back office. But like I said, just to keep this demo a little bit quicker and a little bit to the point, these are the ones, and this is how you can easily manage it. You can turn them on or off as it makes sense for your customer base or as it makes sense for what you're marketing at that moment. Like I said, there's life insurance awareness months, there's auto insurance month, there's all kinds of stuff that you can offer to your customers. Now, let's take this conversation a little different angle. Let's talk about breadth. So we talked about breadth of products. Let's talk about breadth of geographic area. So many of us have a license in a state, maybe 2 or 3 states. And so when we have a referral or somebody finds us that's outside of that world, we have to tell them no. With this website and this partnership with GoldenCare and EIA, you no longer have to tell those customers no. Not only can you help them, but you can help them and receive either referral fees or commissions on that, because your auto insurance, home, renters, business, those types of P&C insurances, those are available in all 50 states. So your customers, your relatives, your friends, your clients, existing, future prospects, all that can leverage these across all 50 states. Virtual primary care and a bunch of our other services that we have to offer in our back office are available for all people in all states. And then we formed relationships, like I said earlier, with different referral partners. So you have built-in referral options where maybe you're not licensed in that state. Well, you don't have to give up on that. Now you can cut yourself in on helping that customer and also receiving some monetary value for helping that customer. So we have lots of really great potential. Now, Dennis, before I get into some of the benefits of the virtual primary care that comes with this as a bonus, is there anything specific that you want me to touch on that we haven't touched on yet?
Nathan, no, I think you're doing a great job giving them an overview of the capability and how easy it is for them to personalize and customize it to their marketplace and to where they want to go as it relates to, as you said, what they're trying to target, whether it's monthly or whether it's just in general that they want to have a site. So I'm anxious to hear about your new virtual primary care, because that's something I think all agents not only could use, but also I think it would be great for their consumers. So please continue.
Definitely. So actually, as you were talking, Dennis, I did think of one more thing. So we talked of geographically and product-wise, how you're filling your portfolio, right? And that's great. Now you can be more of a full service product offering for your insurance practice, which is amazing. Now let's also talk about offense versus defense real quick before we get into that specific wonderful bonus that we're providing. And that is the fact that, you might have said in the past, hey, auto insurance, home insurance, that's just not something I've ever gotten my license for. And by doing so, you're not really playing defense and you're definitely not playing offense because State Farm, Allstate, American Family, Farmers, National General, there's all of these other companies out there that they start and lead with these property casualty products, and then they actually influence a lot of their reps now are heavily influenced to sell in the product world that you guys are selling in. If you don't know, State Farm pays a very low commission on their auto sales unless that State Farm agency sells so many life insurance products. If they sell so many life insurance products, then they actually increase the commission on their auto sales. So all of these other companies have broadened their product portfolio and they're playing in your backyard. And now with this combination of GC and EIA, you're able to do the same. You're able to play in their backyard and you're offering some of the best carriers out there. So when it comes to auto and home insurance, we have the Progressives, the Safecos, the Travelers, MetLife, Liberty Mutual, Mercury is really big in the Southwest. Like we have lots of really great carriers. And so you can be proud to have these offered to your customers. And by controlling that relationship with that customer, you stand less of a chance of that customer reaching out to some other insurance agent to meet their needs. And if they did reach out to State Farm, well, State Farm's going to try and cross-sell them like crazy, all the products that you're trying to sell them. So EIA not only gives you more opportunity to sell, but it also gives you this wonderful opportunity to really own that customer relationship for their insurance needs, because now you can be this insurance marketplace for your customers. And where you have that license, boom, you sell your preferred products, you receive those full commissions, all that great stuff. Where you don't have the license, maybe in the property casualty world, that's where you still have the offerings and you're receiving those renewal or those referral fees, which is really making it really a great 1-2 combo for you. And like I said, now you're owning and controlling that customer's relationship with insurance. And therefore, they're not out there looking for other insurance licensed individuals to meet their needs. All right, so now with that, let's talk about virtual primary care. So as part of joining EIA and receiving our wonderful website and all of these capabilities in this insurance marketplace, you receive virtual primary care free for 1 year. You as the agent receive it free. And this is for your whole family. So for those of you that are single, great, it's for you. For those of you that are just a spouse, just the two of you, it's for you. And for those of you that are, the Duggars, 18 kids and counting, great. Guess what? It covers all of you. So everybody in your immediate family, you receive free virtual primary care. And now this, as you can tell, is not called telehealth, because it's not. It's way more than that. And let's go through it real quick. So not only do you get it for free, but you can also sell it and make money to your clients. Now, it is a virtual primary care, urgent care, and independent medical partner. This isn't where you're going to call and receive some nurse that really can't do much like a normal telehealth. This is where you can set up an appointment. You can set up a virtual video conference where they can look down your throat and they can say, yep, I think based off of your symptoms and the way that I can see what's going on, like you have strep. You don't need to go into the doctor for that. We will send a prescription to your preferred pharmacy, CVS, Walgreens, whatever, and therefore you saved that doctor's visit and waiting and being in the hospital. All those types of things you don't have to do in that example because you can do a lot of that from your home. So this Amaze Health partnership, like I said, it is free to your immediate family as an agent who signs up with EIA for the first 12 months. And Amaze Health, they are trying to change America one patient at a time. And they do that through providing knowledgeable resources, telehealth services, and it's more than telehealth. Like I said, it's virtual urgent care. You can still call, like maybe you're not in the mood to actually get on a video chat. You can still call 1-800 number. But if you want that video chat, they're there. And they offer, medical advice, referrals, prescriptions, all this great stuff. And they have an app that they provide you too. It can do a lot of amazing things. I won't get into too much detail, but this is charged $20 a month, and we're providing it to you for free as part of your subscription to your EIA GC marketplace. Now, not only that, but you get to sell it. So you can sell it to your clients. So let's say you're in the ACA, right? You sell a lot of ACA, Medicare, long-term care type benefits. Some of these people are going to be high deductible health plans. This virtual primary care is a perfect fit for high deductible health plans. Because if you're on the high deductible and let's say the first $5,000 is out of your own pocket, well, I don't want to go into a doctor's visit to find out if I have bronchitis, if I can do it virtually. That might be the only thing I go in for this year. That doctor's visit could cost me a fortune. Well, this virtual primary care only costs $20 a month for your customers and your clients, and they can get all that done outside of the hospital. Now, there are, of course, things that a virtual primary care can't do, but when customers start with this, then that doctor can do that referral, right here. Medical advice, referrals, all that type of stuff. And they'll even help you with billing. And for those of you that sell Medicare, that Part D, when it comes to which prescription drug plan should they be on, Amaze Health can help your clients because they have access to Express Scripts. They will run that customer as per their request to find out what prescription drugs they're on and which drug plan under that Medicare Part D best covers those drugs. Think of that as a benefit for your clients. That's huge, right? And for only $240 a month, or I'm sorry, $240 a year, $20 a month for your clients, and you get it for free for a full year to try it out and see how you like it. And the reason why they're giving it to you for free, the reason why we're giving it to you for free as a benefit of this platform is because we think you're going to use it. And then when you use it, we think you're going to sell it. And you make $5 per month per plan sold. And so you don't have to sell very many, and it pays for this platform with EIA. And after you sell 10, you receive Amaze Health for life for free. We negotiated that with the partnership. And so just selling 10 of these virtual primary care with Amaze Health, and you receive Amaze Health for your family for life. So all that bundled together, Dennis, is now a good time to jump into, the pricing of this platform, or do you want to get into anything else?
Nathan, I'm just blown away. That is not to be a play on words. That is amazing. That's a great name for what they have because, just think about this from, and you're absolutely right. I mean, people typically as agents, they own what they sell, or they sell what they own, would be another better way of saying it. I think that this is fantastic. I think there's so many different ways in which the agent can monetize this and generate revenue from having this website. And I think, yeah, we can certainly go over the pricing, and I'll address. I'll look in the questions and see if there's any questions that we have as we get closer to wrapping up. So, Nathan, you've made a fantastic offer for the GoldenCare agents, and with the bronze plan, as you indicated, they're not PNC licensed, so they don't need any of the other plans that you do have available. But what I love about what you said earlier is the completed quote being a resource is so important, and basically this puts you on a level playing field, as you indicated, with the other all states and the state farms. But we're talking about either a monthly opportunity to subscribe with no upfront fee, or we're talking about paying this annually. So if I recall correctly, the program that we've set up with GoldenCare, it's either $30 a month for a monthly subscription, or if they purchase annually, they will get 2 months free and only pay $300. Is that correct?
That is correct. So this is, like we talked about, this is an amazing deal. There's so many ways that you can make the money that pays for this whole platform by itself because of the referrals, right? Everybody needs auto and home insurance. Every business needs business insurance. Virtual primary care, there's not a person that has a high deductible health plan that this shouldn't be a benefit for, right? So there's a lot of really great ways that $30 a month can be paid for over and over and over again with just a couple sales in a year
Well,
for some of these products.
well, the virtual primary care, I mean, that's a $240 value right there that they're getting for free. So,
And
and if you
possibly
look
free
at
for life if you sell only
and
one.
free, yeah, and free for life possibly. You know, the Medicare, we've set up a program to utilize GoldenCare's Medicare referral platform. If you don't sell Medicare, if you do, then as Nathan indicated, you can turn off that tile and just have the quote capture come to you. On the longevity, as Nathan walked you through, I mean, one long-term care referral. Maybe you don't specialize in long-term care anymore. Maybe you used to at one point, or maybe you just don't want to deal with the 8-hour partnership. One couple today is typically about $4,000 premium, and you could make, you know, probably better than $1,000 to $1,500 just on a referral. I mean, that varies again based on what the annual premiums are, but there is definitely, as you said, between the life insurance, the long-term care, the Medicare, there's all kinds of ways that you can drive more sales and really make money in some cases while you're sleeping, because your clients are actually going to go on and shop and do this sometimes without actually needing assistance. In fact, I think, Nathan, you said earlier when you mentioned about the life insurance, that uh, life insurance option, the agent cannot be involved. So it's just a very simple click, 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 and they actually can own a term insurance or a juvenile health policy, correct?
Correct. As you saw on my screen right now, it was that quick. Somebody can go to your life insurance page and you can control this too. You don't have to turn this on, but for those of you that want to, yeah, you can turn this on. They click on learn more. It opens up a link and they can apply, and here it goes right through the process, and they can buy online
Yeah,
directly from your website.
it's amazing. And I get asked this question also that you may want to address before we wrap up and see if there's any additional questions. Nathan, someone will say, "Hey, I really like my website that I already have," and for those that don't, and maybe they're paying too much, because on average, as I've researched this topic as we were creating a partnership, I was seeing on average $60 to $70 a month, not including perhaps a setup fee. So two questions. One, they could obviously move some of their information, as you said, onto this platform that they already have, or if they wanted to keep their existing website, what's another option how they can utilize this particular platform?
Yeah, great point. So just so everybody knows, we have been around for a while. So we built this company back in 2019, and we went live because it took us a little over a year to build a lot of the infrastructure and technology and relationships and partners for this. So we went live in August of 2020. So we have been around for a little while now, and we have agents just like what you're talking about, Dennis. We have agents and agencies where they're like, hey, I already have a website because I specialize in Medicare and I don't want to change that website. My customers like that website. Great. Leave that website as is. On that website, maybe build another page on it that's really quick and simple and easy that says more offerings, more products. Let me help you with all your other products. I have this wonderful relationship. Go here. And it's an easy link that goes from that website that they've had for years that works for them for their one niche, and then it bridges over to here. Or maybe it says something like, hey, in the state of Maine, I'm your person, right? I'm your agent. Outside of the state of Maine, click here because they're not licensed in anything else outside of Maine. And so then they send them to this platform where, again, now a lot of these are going to give you a nationwide presence. So more products, more abilities to own that customer, more customer capabilities across the country. Like it's just a really great fit for lots of people. And then to your point, Dennis, we had lots of people shut off their websites like, hey, I was never really a big fan of my website, or it was just more of a digital business card that was costing me 70 bucks a month. It couldn't really do much. So I'm going to save that 70. I'm going to turn this on for 30. And now I have all kinds of other ways to make money in a very well structured, beautiful format that we believe and we've tested with lots of consumers that they like this way better than a State Farm, an Allstate, American Family, or Farmers Agent's website.
And Nathan, what I love about having the auto and homeowners is that, many of the agents out there they do take a holistic approach. They want to be able to evaluate, and clients do ask them about, even though they know they don't specialize in this area. And what I like about this is the money saving opportunities that agents may have for their clients who perhaps haven't shopped their homeowners in some time or their auto insurance. And the money that they save can be reallocated to other services that the agent is looking to offer the client, whether it's a final expense policy, whether it's a Medicare plan, whether it's long-term care, the life insurance. I'm not sure how much money they would save, but whether they're saving, 50 bucks a month or 600 bucks a year or $300 a year, the whole idea is that you are being a resource to that client and that you're helping them by driving again this activity to your website where you are more than just a single product specialist in one particular area. And again, the flexibility is yours. That's what I love best is that you can turn on or off what areas of emphasis that you want to focus on.
Dennis, and as you were saying that, maybe I didn't hit this already, and that's a good thing that you brought it up then, because I want to make sure everybody on the call hears this. You know, this can be a lead or sales enhancing tool. So if one of your customers goes online and let's say they buy Medicare from you or longevity planning or whatever, life insurance, and they also save money on their auto and home, it just so happens, at least in my world, from my agents that we talk to and everybody else, like customers are willing to talk about how much money they saved on their auto and home. They don't know how much money they saved on Medicare or their long-term care because they're not doing a true price comparison, right? You didn't have long-term care. A lot of people don't have long-term care and then buy a cheaper long-term care and then tell everybody about the money they saved. That's just not a conversation that happens at barbecues and family gatherings and things like that, but they will say something about their auto insurance. And now that gives you an agent who never could capture that lead before because that was never in your wheelhouse. Now that's an opportunity. Now when one of your clients comes here and they save, I actually saved, I sell also, by the way. So I saved one of my buddies who I never pushed to sell insurance to. He just asked me. He's got 3 kids in high school. So he pays a lot in auto insurance. I switched him from American Family to State Auto through this process, and he saved over $1,500 every 6 months. Now with that $1,500, now we can have a better conversation about, well, what are you going to do with that? Do you want to buy an annuity? Do you want to buy more protection? Like, what do you want to do? So it can be used as a wonderful lead generation tool or a sales generation tool, because now, to Dennis's point, you freed up money in that customer's budget. What they do with it, you can help get in their head right away and talk about, let's talk about, where the best place to put that is for your longevity of your family, of your future. And those are conversations that without this type of platform, you're just not going to get cut in on. You're going to miss out, and that State Farm agent's going to have that conversation. Or American Family or somebody else is going to have that conversation. And now you're in.
Hey, Nathan, one last point. That's so important that you drill down on that particular point. you shared this with me before, and I know working with seniors, I was amazed that you had said in doing your research on additional tiles and things that you wanted to add, that the seniors really are concerned about security, home security. And I thought what was interesting is that you would put on, although you're not showing it here, I know it's available, the ability for that senior or any individual who perhaps is looking to add a home security system. And I don't want to talk specifically what the agent gets compensated. But it is very generous, and we can cover that with you separately. But it's just the opportunity that you can be a resource in something that is really not an area that oftentimes you would think about, but yet seniors in particular think a lot about.
Yeah, so Dennis, I'm with you. Let's not get into the financials with everybody at this one, even though it's very lucrative. But let's talk about something that's going to hopefully make all of you feel better about all the products and services we put on this platform. This is not just somebody throwing all this together so that we get the highest commission possible. We look at the full consumer experience. So when we form this relationship, who, as you can read here, the security provider is ADT, but we didn't form the relationship directly with ADT, and there's a reason for that. We love the back office technology and the support and all of the wonderful connections they have with the local police and fire and all those rescue services. That part of ADT we were a huge fan of, but we weren't a fan of their sales practices. I wasn't a fan when we built this relationship for how they sold the product. A lot of ADT sales distributors, they send out a person that in person walks around the house and does a high pressure sales event with scare tactics. And that is not a process that we liked. So we formed a very special relationship with a company called Secure 24. So Secure 24, they're an authorized ADT dealer. So you get all that great back office platform process. But from a sales perspective, it's very non-confrontational. There's a phone call that's set up where they have conversations with your client. Let's say in this example, it's an elderly client. Well, how many windows do you have on your first floor? How many, windows do you have in your basement that are accessible? How many doors do you have? All right, now let's build you a plan that secures that appropriately. What's your level of safety you're looking for? They describe all of that over the phone. They tell the customer that for everything we just discussed that you influenced, here is your price. Are you interested? If so, we'll send out a technician to install it. But there's not that high pressure in-person sales event. And so that's where we really thrive. We're looking for great products that the customers need in a wonderful sales process. And that's why we form a relationship with Secure 24 and not directly with ADT. Because again, we love the back office of ADT. We love the sales process of Secure 24. And so hopefully that just makes you feel really good about not only is this a great product to have on your portfolio, but for this relationship with GC and EIA, the products we put on here, they are good and really good products.
That's
And we make
wonderful.
sure of that.
Nathan, thank you so much. I think we've reached, I know we started a few minutes late. I did check the questions. I didn't see any questions that we had not already covered during the course of the webinar. I want to let everyone know who's on the call that you'll be receiving a follow-up email from marketing at GoldenCare that will give you the instructions again on how you can take advantage of this wonderful platform, whether or not you'd like to do it on a monthly basis at $30 a month, and whether or not you'd like to do it on an annual basis. And Nathan, just so that everyone knows, let's say that someone today or a number of folks who've been on the webinar say, hey, I'm going to sign up and pay annual. How is it that do they automatically, once they have signed up, do they automatically get enrolled in the Amaze Health virtual primary doctor? Or is that a separate communication piece that comes out from your office to them direct to be enrolled?
Yep, so there's going to be a two-step process. You're going to get a welcome email that's going to provide you with all the information you need in order to, sign into your back office and finish setting up your website. So in here, you're going to be able to set up your website and go through and do all those wonderful things. Now, uh, following that, after you set up your website, about a day later, you're going to receive your access and information for Amaze Health. And so you're going to receive not only your own personal account, but then you're going to receive your own personal link that then you can come in and your customers, you could either send that link via email or they could go to your website and this link will be hooked up for you to where your customers will be able to register and sign up for Amaze Health. And when
That's
your customers register again, it is $20 a month, but that $20 a month is a great, amazing deal for most people that are on a high deductible health plan, and even people who aren't on a high deductible health plan. Maybe they have, hey, I have to go in, once a month for something, and my copay is $50. Well, did you have to go in? Could you get that done virtually? Because this is $20 a month, right? So it has a great fit for so many customers. But yours is free for the first 12 months. And after you sell 10 total, it's free for life.
That's fantastic. Nathan, one final thought. I just as I thought about this value proposition that you've offered today, it's amazing. As agents and advisors, the hardest thing that sometimes they have to do is to think about the money that they have to put back into their business to grow their business, and sometimes they think, wow, that's a big purchase decision that I'm going to upgrade my computers or I'm going to invest in some direct mail campaign. And I'm thinking to myself, as you've gone through everything today, oh my gosh, if if you just utilize that virtual primary care platform yourself, that's a $240 value. You probably spend more on coffee or on whatever type of services that you might have on a daily or weekly basis, where $300 and the opportunity to monetize this with getting the 2 months free, it normally being $360. I think it's a decision that's a pretty darn easy one. And I want to thank you so much for your time today. And we want everyone to really evaluate how you can grow your business. And hopefully by being on this webinar, you'll see that this is a tool, a platform that will definitely be an enhancement to your individual practices. Any final comments, Nathan, before we let everyone go? I didn't see any additional questions.
So I'll just wait to hear from yourself or Corey, and I will help out with any questions that an agent has after the fact if there's none during this meeting.
Again, Nathan, thank you very much. And we hope that everyone enjoyed being on the webinar. And everyone, we wish you a good rest of your day.